Hello everyone. So today we'll be talking about retained placenta, and it is one of the complications of the third stage of labor. And the placenta is said to be retained when it is not expelled out even 30 minutes after the birth of baby. And it is, according to WHO, it is 15-minute time period is taken, and this time period is arbitrary. Uh, and the causes of placental retained placenta are there are three phases that are involved in the normal expulsion of placenta. That is, one is separation through the spongy layer of decidua, next is descent into the lower segment and the vagina, and finally its expulsion to outside. And any interference in these three physiological process result in retention of placenta. And one is the placenta completely separated but retained, and this might be due to poor expulsive effort. Due to poor expulsive effort, the placenta might separate completely, but it is retained inside. And next one is due to uterine autonicity. It is commonest cause of retention of non-separated placenta in atonic uterus, and also atonic uterus was one of the most common cause of postpartum hemorrhage. So simple adherent placenta is due to uterine autonicity. In cases of grand multipara, over distension of uterus, prolonged labor, and uterine malformation, or due to bigger placental surface area. And next we have the morbidly adherent placenta, the partial or rarely complete, that might be the causes. And the placenta incarcerated following partial or complete separation due to constriction ring, hourglass contraction, and premature attempt to deliver the placenta before it is separated. That is another. And the diagnosis of retained placenta is made by an arbitrary time, that is 15 minutes, is spent following delivery of the baby. The feature of the placental separation are accessed, and the hourglass contraction or the nature of the adherent placenta, simple or morbid, can only be diagnosed during the manual removal. And the dangers, the risk involved in the prolonged retention of placenta are hemorrhage. Shock is due to the blood loss and at times unrelated to blood loss, especially when the retained more than 1 hour. Puerperal sepsis, and next is risk of its recurrence in next pregnancy. For the management, the one is we have the period of watchful expectancy. During the period of arbitrary time limit of half an hour, the patient is to be watched carefully for evidence of any bleeding, revealed or concealed, and to note the sign of separation of placenta. And the bladder should be emptied using rubber catheter, and any bleeding during the period should be managed as outlined in the third stage of labor. And the retained placenta, it can be separated, unseparated, or complicated. The placenta is separated and retained to express the placenta out by controlled contraction. And unseparated retained placenta, they are done by manual removal of placenta is to be done under general anesthesia, as we have discussed in the previous video on PPS. So that was about retained placenta, and thank you.